How you doing? Yeah, yeah. Well, my name is Dr. Wright, but you can just call me Daniel. It's fine. Yeah. So, tell me, what brings you in today? Okay. All right. Yeah. How often does that happen? Almost every day. Okay. All right. So, what I would like to do, let me just start with a basic cranial nerve exam. Okay. We're gonna cover everything today. Uh, I don't normally make house calls, but since you know me, I figured I'd stop by after work. But with what you're describing, I would really like to go over everything. I would like to cover taste, smell, touch, and sight, if that's okay with you. Yes. Well, we're already going to cover hearing with what you said you've got going on, but all five senses, hearing, taste, smell, touch, sight, we're going to cover it today. Yeah. Okay. Listen, I know this is scary, but it's okay. You're going to be just fine. How long have you known me? And you called me first. And I think it's because of my skill. Well, let me grab some gloves. Yeah. No, I actually grabbed these at the office and then I shoved them in my bag. So, yes. Okay, well, I'm going to do my exam. But let's take your mind off of this for a second. Aside from your medical problems, how was your day? Oh, it takes me forever to get these gloves on. Yeah. It's fine. It's fine. It's fine. Listen, don't stress about this stuff, okay? It's gonna be fine. You are gonna be fine. You know, it's funny because I always have a running joke with anyone else that I know. The patients that worry the most are the staff at my office, and then my friends and family. They worry more than any other patient that I have. Yes. Okay, so I'm actually going to do something first. I'm going to do the touch aspect first. I'm going to group these into senses so that you can kind of follow along with me. I'm going to make this as easy as possible for you. Okay? Yes. Yes. Okay. Do you have any other questions before we get started? Okay. Now what I'm going to do, is it okay if I examine you? Good, 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 good. All right. So I am going to just start by kind of just taking a general look at everything. I kind of just want to see what's going on here. All right. Does this have any tension? Does this hurt? No? Good. Good, 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 good. What about this? Does this hurt? No? Good, good, perfect. Good. What about here? Okay. Now I am gonna go over here just a little bit and see what we got going on here. Now, how'd you get that gash on the side of your head? How'd you get the gash on the side of your head? Wait, when did you do that? Yeah. I mean, it doesn't look that bad, but it is enough to cause a little bit of mild blurriness because right here is where a lot of your muscles attach to the front where your eyelid is here. So, and you may not even have any blurriness. I know you didn't even say that was a thing. But if I'm being thorough, I'm going to be thorough. Okay, so let me just kind of feel around here. Yeah, honestly, it's not a big deal. I don't want you to ever feel bothered or feel uncomfortable for calling me. There's a reason I went to school to be a doctor. Yeah. Okay, so nothing that I'm touching or doing right now feels particularly painful. Gotcha. I am touching on your face, and a lot of people stress out a lot and hold tension in their head. So tension and sensitivity I'm not really worried about, but I'm kind of looking for if I touch you, and then there's a little bit of pain there. And I'm not seeing anything like that right now. So that's good. That's good. That is good. Okay. So aside from the touch aspect, is there anything else that feels particularly problematic to you? Okay, so I am going to leave my gloves on, and I am going to go to the smell portion of this. Most people like the smell and the taste portion of this. It's kind of fun until I put a droplet on your tongue of something that you might not like the taste of. Alright, so what I'm going to do is I'm going to hold up some scents. I'm going to hold up some scents, and I'm going to let you tell me what they are. I'm going to let you tell me what they are. Can you do that? Okay, perfect. Now, this first one, I am going to shake these up a little bit, just because I've noticed if you shake them up beforehand, then it kind of makes the smell a little more potent, and I don't want you to freak out or misidentify something just simply because you can't smell it, and that's not a problem of yours. So this first one, I'm going to hold this up to you, and I want you to smell it. Give it a good whiff. Okay, good. Now, what does that smell like to you? Yes, just vanilla. Good job. All right. Now, I've got another one. Yeah. Now, we're going to give this one a good whiff. Good. So, what was that smell? Orange. It was. Typically, it wasn't specifically orange. It was like just a kind of a general overall citrus. But, yes, I kind of did that one on purpose because a lot of people smell the vanilla, and then the other ones, they'll kind of get a little hint of vanilla as well, so I kind of use that as a palate cleanser since it is a little bit more of a stronger one. And we've got two more. Let's see here. Alright. I'm going to hit you with this one next. See, cranial nerve exams are fun. Okay, for me, maybe not for you. But you seem to be having a good time about this, so let's check. Alright, you ready? Are you ready? Okay, and that is what? You want to smell it again? Here you go. There you go. What do you think? Caramel. It is. Caramel. We say it differently, and that's fine. One more. Oh, I forgot to shake this one up on you. I'm trying to sabotage you here. Just kidding. Yeah. You know, I go to school for about 10 to 12 years after you get your initial degree, just so that I can let people smell and taste things. You ready? There you go. Strawberry, you got that one immediately. But you told me, I think strawberry ice cream is your favorite flavor, right? See, I know things. Alright, so that was all of the smells. So, you want to do taste next? Or do you want to... Actually, let's do taste next. Alright. So I am going to shake these up as well. Yeah. Yes. Okay. Now, this one is a dropper. I'm just going to drop it on your tongue. One drop. And I'm just going to let you tell me just one drop. No worries. I want you to tell me what it is. You ready? Are you ready? Okay. What was that? I'm not giving you another drop. You're going to take that one as you get it. Salt. I try to get the bad ones out of the way first so that you can end on a good note. Granted, you get them right. Okay, yes. I like to shake these up too. I don't really ever want you to get a really, really intense flavor or a really non-goopy, gross flavor. And I don't really know if these are homogeneous or heterogeneous mixtures. So I like to make sure the flavoring is just there, you know. Alright. Now. You ready? You should enjoy this one. Just a disclaimer. There you go. What do you think about it? Sugar. With sugar. Yeah. I gave you salty, and then I gave you sweet. Yeah. We got two more. Okay. Now. This one may or may not throw you for a loop. It just depends. I like throwing people for a loop. You ready? You've got that look. You've got that look. What is that? What is it? Caramel. Yep. So, what I like to do, I like to purposefully put sugar and caramel together because you get a flat out sugar taste. And then with the caramel, not only does it throw you off because you also had a scent that was caramel, but caramel is cooked sugar, so there's a very, very minute change. And if I give you the smell first, it's already on your mind, so you're kind of primed to be in the general vicinity to get that one right. So generally, people who get that one right, I know that there's not necessarily anything wrong with your smell or your taste, or at least your olfactory nerve, because they're kind of connected when it comes to smell and taste, you know? Now I got one more. Got one more for you. I'm excited about this too. You ready? Yep, that was peppermint. I usually save peppermint for last. It's so powerful and overwhelming that it's the only thing that you're gonna taste if I give that to you first. You know? Alright. So, now I'm gonna move on to the audio portion of this. And I want you to tell me if you hear this at all, and if it's on the left or the right side. Can you do that? Can you do that for me? Good, 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 good. You ready? Nope. I did it right here, but I did not do it over here. Good job. Now, yes, correct. Now, close your eyes for me. That was my stomach, yes, I understand. All right, keep your eyes closed. Keep your eyes closed. Keep your eyes closed. Yep, correct. Correct, it was on this side. Now close your eyes again. Now open. Correct. It was right in front of you. I didn't do it on your sides at all. I didn't do it on your sides at all. I'm going to do this one more time. You ready? All right. Which side? Yes. Okay. Now, let's do the visual portion. So this is what I'm going to do first. I'm going to stick my hand out here, and I want you to look directly at me. And then I want you to tell me when my hands get in your peripherals and you can see them, okay? Okay, so look directly at me. And I want you to tell me when you see my finger. There you go. You see it. Okay, perfect. Perfect, perfect. Now, I want you to tell me when you see it on the other side, but look directly at me. Look directly at me. Look directly at me. There you go. Yes, correct. Now I'm going to hold my hand back here, and I want you to tell me when you see my finger. Look directly at me. Look directly at me. Okay. That was a little far. Now, I want you to tell me when you see it in your field of vision. Look directly at me, look at me. Okay. It's a little bit wider on this side than this side. Now, I want you to tell me if this it's sensitive to your eyes or not. You ready? You can't see that? Okay, it's off. You can't see. Hang on. Hang on. Don't panic. You're fine. You're fine. Do you see that? Okay. All right. No. No, no, no. Don't do that. I want you to look at this finger right here. This finger. Focus on this finger, okay? The light is on. If you can't see it, it's okay. I'm just going to take a quick look. Are you still staring at this? Now I want you to move your vision from finger to my face and then back to my finger. Okay. All right. Lights off. Lights off. I want you to look at my finger. Okay, now I want you to move your vision from my finger to my face and then back to my finger. Okay. All right, I'm going to take another look at that little gash on the side of your eye. Yeah. I really want to take a look real quick and see. Okay, so you said this is very tender and kind of hurts, yeah? And you said it's been several days? Okay. Alright. On a scale of 1 to 10, how bad is the pain? Okay. This is what I'm going to do. Looks like you've done a pretty good job taking care of this up here. So I want you to come into my office tomorrow morning. You don't need an appointment. I don't care. I'm going to kind of disinfect this a little bit more, patch it up, see if I can throw maybe a stitch or two in there, because I don't have my equipment with me right now. And since you've already gone a couple of days, that's perfectly fine. And then I'm going to get you a referral to see an optometrist, just so that they can check everything out. And that they're going to be able to check your vision, make sure there's no damage to that. I'm also going to put on the referral that you're not able to see that light. And I don't know if that is because of the gash in the side of your head, or if it's just a simple, there are cones and rods in your eyes that detect light and dark. And there are tests that an optometrist can do that I am not able to do. Okay. But don't panic. You're fine. You can see your vision has not decreased in the past couple of days from having these symptoms start. So it's just a matter of treating that wound and just doing some testing at the optometrist's office. You're fine. The best thing that you can do is just get some sleep, okay? Yes. You're going to live. Now listen. It is kind of late, so I am going to go. I wouldn't go if you weren't fine. I know you're panicking a little bit. Drink some water, relax, turn some of the lights out, get ready for bed, and try to have a good night's sleep. And then I'll see you in the office in the morning, okay? Okay. You have a good night.